One of the things I hear most from people with Sjögren's is this: I'm doing everything right for my teeth, but why does it feel like things keep falling apart? And if that sounds familiar, I want you to know it's not all in your head, and it's not necessarily because you're doing something wrong. Sjögren's changes the environment inside your mouth in ways most people, and honestly many healthcare professionals, don't fully understand. And today I want to explain what's actually happening, what to look for, and what you can do to better protect your oral health. Hi, my name is Dr. Carol Wada. I'm a quadruple board certified allergy, immunology, lifestyle medicine physician. I also personally live with Sjögren's disease. And today we're talking about one of the most devastating and preventable consequences of Sjögren's, what this disease is actually doing inside of your mouth, why so many folks keep missing it, and exactly what I want you to ask for at your next dental appointment. Save this before you go. And as always, this content is for educational purposes only. It is not medical advice, and you need to work with your own healthcare team. Okay, let's get into it. Let me tell you first about someone we'll call Sarah. Sarah was someone who tried pretty hard to take care of her teeth. She would go for regular cleaning, she was brushing, she was doing the things that she thought she was supposed to do. Now, could she have flossed maybe a little more consistently? Sure, can't we all? But over time, she started running into dental issues that felt confusing and frustrating. Cavities that kept showing up, fillings that needed to be replaced, her first crown at around age 30, and a mouth that just never felt quite comfortable. And each visit seemed to come with new instructions. Increased fluoride, brush this way, try this specific electronic toothbrush, be more consistent, and Sarah kept trying. But what no one had connected for a long time was the bigger picture that mattered. The dry mouth she had adapted to, the fatigue, the symptoms she had normalized. And eventually, a dental hygienist noticed a pattern, noticed decreased saliva pooling in her mouth, and asked a different type of question. Has anyone ever talked to you about Sjögren's? And that question changed the trajectory of her care. Now, certainly it didn't erase what had already happened, but it gave Sarah context and the reason things had felt so hard. More importantly, it gave her a care team that understood what her mouth was up against and better strategies to protect her oral health moving forward. One of the first things she said when everything was said and done was, "I wish someone had connected the dots sooner." And I want you to be honest to say that Sarah's story is actually based on my own story and my own experience of that recognition with the dental hygienist of saying, aha, you have a dry mouth. And that's when the dots started connecting in my mind with dry eyes and other symptoms, right? If you want to learn more about my full story, you can look at our Sjögren's playlist, and there is one about connecting the puzzle pieces, and I dive into my full story there. But I hear versions of this all the time, and that's a big part of why I wanted to make this video, because the sooner we connect the dots, the more options we have. So what is actually happening in your mouth? Here's what Sjögren's disease may be doing inside your mouth and why understanding it matters. At first glance, dry mouth, seems like an inconvenience to have a little sip. Can be pretty annoying, sure, but maybe not necessarily serious. But the reality is that saliva plays a much bigger role than most people realize. In Sjögren's disease, the immune system targets in part the salivary glands, and over time, those glands may not produce saliva to the amount that they once did. And in some cases, they actually can't produce really any saliva at all. That changes the entire environment inside the mouth because saliva is not just moisture. Saliva helps to clear bacteria, it buffers acid, it helps remineralize enamel, and it protects the tissues of your mouth and helps maintain balance in the oral microbiome. So when saliva production drops, the mouth loses some of its natural protection. Bacteria are harder to clear, acid lingers longer, and enamel becomes more vulnerable over time. And this is why people with Sjögren's disease, and frankly, other reasons to cause dry mouth, experience dental problems even when they're doing all the right things. So what I started noticing in my own patients, and frankly, in extension of my own lived experiences too, were these folks were not neglecting their oral health. In fact, many were incredibly conscientious. They brush, they floss, they go to their routine cleanings, they follow, the standard recommendations, but they still find themselves dealing with recurrent cavities, gum line decay, sensitivity, and dental work that seems to fail earlier than expected. And over time, it really becomes clear that we underestimate how much salivary dysfunction changes the oral environment. And research really backs this up. One 2023 study looked at salivary pH in people with Sjögren's compared with healthy controls. On average, the healthy controls had a neutral oral pH, which is about 7. But those of us with Sjögren's, those patients had a lower pH or a more acidic pH, closer to 6. So why does that matter? Well, our enamel becomes more vulnerable in acidic environments. So that would help explain why standard dental routines are sometimes just not enough on their own, and why people with Sjögren's often benefit from a more protective strategy. There's a meta-analysis, which is a study of many studies from 2025 that looked at a total of 3,700 patients, and that people with Sjögren's experience a greater burden of dental disease over time, including higher rates of tooth loss, even among people receiving regular dental care and following for good habits. So if you've ever felt like you were somehow failing at taking care of your teeth, I really want you to hear this. It is not simply a hygiene problem. There's biology driving this. So another piece that often is overlooked is oral candidiasis, or yeast overgrowth in the mouth that can happen more easily when saliva is reduced. And sometimes this can cause obvious symptoms like burning, changes in taste, or white patches called thrush. And other times it can be surprisingly subtle. Now, not everyone with Sjögren's has this, but it is common enough that it's worth thinking about screening for, and especially if symptoms are not improving or dental problems keep recurring, it should be something that we should at least think about. Now, before this starts to feel overwhelming, I want you to hear something important. There's a lot we can do to better protect our oral health once we understand what we're working with. And I want to say this clearly. Some dentists are really incredible. They're doing a great job at catching this. And as I mentioned, my own diagnosis started with the comment from my dental hygienist when I went for my checkup. It wasn't a rheumatologist, it wasn't an immunologist, it was the dental hygienist who noticed that something wasn't adding up and that I didn't have a lot of saliva on my exam. And that moment in my care really changed the trajectory of my health. So, I don't want to place blame on our dentists. Many are super exceptional, our dentists and our hygienists, at recognizing patterns. But this awareness varies, and that means you can't assume that every healthcare professional is automatically thinking about Sjögren's specific oral risk. So the more that you understand what Sjögren's can look like in the mouth, the better equipped you are to advocate for yourself and to have those conversations early. And frankly, that matters because for many of us, the mouth is one of the places that Sjögren's is going to show up a little earlier potentially on physical exam. Sometimes our mouth is giving clues before the rest of the picture fully comes together. And for others, that dryness may come much later in the clinical picture. So what should dental care actually look like? So we've talked about a little bit of the science behind what's going on. So what can we now do about it? Because this is where things can genuinely change when we understand the risks and we can be more proactive. So there are some great expert guidelines from the American Dental Association and EULAR, and many dentists are already doing some of these things, but others may not be as aware of the recommendations or Sjögren's specific oral risks, which is why bringing this to the conversation can make such a difference. So first things first, you gotta schedule your dental visit. For many people with Sjögren's, scheduling those checkups and those cleanings every 3 to 4 months makes more sense than every 6 months. Now, 6-month intervals were designed around average risk, and that is typically what most dental insurance plans are kind of built in as their standard. But reduced salivary function changes that risk equation. And so it is worth talking to your dental office. Often they may be able to provide a cash rate for a cleaning or some other ways to kind of help you out in that situation so that you might be able to get in a bit more often. And that's worth talking with your dentist and dental team about. Second, prescription strength fluoride, specifically 1.1% neutral sodium fluoride toothpaste or gel can be used daily. This is different from standard over-the-counter toothpaste and can provide added protection for enamel in a dry mouth environment, and it's worth asking your dentist whether it makes sense for you. I also have started incorporating once a day a nano hydroxyapatite based toothpaste that also has fluoride in it that I had talked with actually our pediatric dentist about. She's a brilliant colleague and she had recommended it for my kiddos that unfortunately inherited my oral microbiome to some degree. And so I used my prescription once a day and I used that one once a day to get a little bit of both benefits. The third is your fluoride varnish at dental visits. For people at high cavity risk, professional fluoride varnish can be an important additional layer of protection, and so many of us with Sjögren's are going to fall into that category. Fourth, screening for oral yeast or candidiasis. If symptoms feel out of proportion, irritation persists, or dental problems keep recurring, if that's present, then treatment can make a meaningful difference. Sometimes this may require, in more complicated situations, connecting with an oral medicine specialist. These folks often may have undergone training both through dental school and often also through medical school. Frankly, I can't even imagine going through both. Thank goodness they love what they, that's their area of expertise, but that is another possible member of your healthcare team that may be very helpful for folks with burning mouth or some of these other symptoms that can be complications that can be really, really problematic, and that's minimizing it. The fifth is to talk with your physician about saliva-supporting medications if your dryness is significant. So medications like pilocarpine, sibutramine can help stimulate remaining salivary gland function in some people. Now, they're not right for everyone, but this is a conversation worth having. I also want to put a quick plug. One of the things that many of these medications for Sjögren's that are under clinical trials are looking at is they're looking at response rates from salivary flow and tear film. And so we are noticing that for many of these disease modifying drugs that are in trial, we are seeing an increase in salivary production and tear production as those results are being shared. So I think that's another exciting aspect that we can continue to look forward to more information being published on that. And lastly, one of the simplest tools is Xylitol. Sugar-free xylitol mints, gums, lozenges, sprays. They can help support oral health by reducing cavity-causing bacteria and stimulating saliva. There was some concern that was from a paper that was published a little over a year ago about the possible impact of xylitol on cardiovascular health. We'll have to record another episode digging into that, but suffice it to say, for many folks, the use of a small amount of xylitol containing products to help with oral health very likely weighs in the benefit versus the risk for that. But again, talk with your healthcare team about your specific recommendations. While expert guidelines support this approach, we still do need more Sjögren's specific clinical trials. Much of what we do is based on the best available evidence plus expert consensus and what we know about salivary dysfunction more broadly. So the good news is you're not powerless here. And now that you have a better understanding of what your mouth is up against, we can build a care plan that actually matches your biology. So at your next appointment, what can you do? You can tell them about your diagnosis when they're doing your intake. Not as an afterthought at the end of the appointment, bring it up from the beginning. You might say, I have Sjögren's disease. I know this changes my oral health risk. Can we factor that into my care plan, as we're talking today? Second, ask whether a 3 to 4 month recall schedule makes sense and what this might require from a cost standpoint if there's a way to get insurance coverage. For many people with Sjögren's, more frequent monitoring can help catch changes earlier and provide additional protection. Third, ask about prescription strength toothpaste and the professional varnish. Some dentists may already recommend these once they understand the context of Sjögren's, but it's also okay for you to bring them up and to ask. And then if you are having more symptoms, say, hey, are there any signs of yeast in my mouth? I've heard that I'm at increased risk of that with drier mouth. As both a physician and someone living with Sjögren's, oral health became one of the clearest reminders for me that this disease is affecting the whole body and it's all interconnected. Despite dental insurance being a different entity, like in our US healthcare system, the mouth is not separate from the rest of the body. It is part of our GI tract. It is intertwined in our immune system, and it's one of the places where this disease can often speak pretty loudly. And once I understood that, I stopped viewing dental care as something separate from Sjögren's care and really how it is just part and parcel with this whole conversation. So for anyone who has already been through significant dental loss, repeated cavities, expensive dental work, implants, years of feeling frustrated and confused, I want you to know that there's context for what happened. We know that Sjögren's changes this oral environment in ways that standard dental advice wasn't really fully designed to address. And so many of us with Sjögren's are doing the right things often, or what we think are the right things, and we're still struggling. So if you've been carrying guilt or shame or feeling that you failed somehow, I hope this conversation helps you set some of that down and let go of a bit of that, because there are real physiologic changes happening, and I think understanding that really matters. Second, if you're earlier in this journey or prevention is still the major focus for you, this is your opportunity to get proactive. Use this information, bring it to your dentist, start the conversation, ask the questions. When we understand risk earlier, we often have more tools available to protect ourselves. And if you're already in a season of restoration, implants, crowns, rebuilding, this conversation still matters. It's never too late to have a care plan that actually reflects the biology of what's going on with your immune system, your oral health, and your Sjögren's. And you deserve a team that understands what your body is working with. If this video gave you language that you didn't have before or helped you finally, something finally clicked, please share it. Send it to, another member of our Sjögren's community. Send it to the friend who has shared their story with you, because understanding why something is happening really can change everything. And if this conversation resonated with you, I want to personally invite you to join us for the 5th annual virtual Sjögren's Summit, Thriving in the New Era. It's coming up this July. We have our wait list going. We're going to open registration soon. It is free to attend live, and this is the kind of conversation that we will go deeper on together, bringing together oral health experts. We're bringing together medical experts, folks from our community, having nuanced conversations that I wish all of us had access to. If you're tired of piecing things together on your own and you want to better understand how to advocate for yourself, support your body both holistically and looking ahead at newer medications coming down the pipeline, I think you'll really feel at home at the event. And even if you can attend live, we have the replays up for a couple of weeks after, and then ways for you to access those long term. The waitlist link is in the description below. If this video helped you feel a little more informed, a little more validated, or a little less alone, make sure to hit subscribe so you don't miss what's coming next. We have a new episode every week. And until then, I'll see you next time.